The American Heart, American Stroke Association has several things that it does. So we tell people what stroke is. The word is out there because people don't know what a stroke is. So one, we get them in because of that message. Two, we as a hospital know what to do when someone comes in, and we can treat them quickly, and that's because of target stroke. And get with the guidelines. The people who get in and have to stay in the hospital for a while, and we have to treat them, we need to be able to take care of them in the best way possible, and that's what Get With the Guidelines does for us and our community. When we started, about 2007 was our first time that we participated and got certified as a primary stroke center. And you looked at our data then. We used to sit in committees and we'd be excited if we had a few things going right as far as measures and the guidelines. And we would sit in our monthly meeting and go, look, we got someone we gave TPA in 60 minutes or less. And we knew that that's just not where we wanted to be. So we had a great stroke director at that time. She and other leaders helped us connect with the American Heart, American Stroke Association, and that's when we got involved in Get With the Guidelines. So it was with a goal in mind of achieving better care for our community and our patients. We know that the guidelines are evidence-based and that they're the best thing for our patients. So when you want to improve care, you want to go towards something that is evidence-based. The safety and evidence-based practice in the guidelines help you take care of patients better. DVT prophylaxis, dysphagia screening, doing the best thing for our patients, giving them the right medications when they arrive, giving them the right medications to go home, trying to prevent a secondary stroke. These are the things that the guidelines help you do. And then, of course, target stroke is that work to somehow improve our practice for the hyperacute stroke, the person that's called 911 and gets into the hospital right away. Are we ready to do the best thing for them as quickly as safely possible? In 2009 even, we would have a few cases where we were doing TPA or alteplase with under 60 minutes. And we just knew that had to improve. Target Stroke made recommendations, the best practice initiatives. And if you looked at those, like having a team, having a protocol, working with EMS, having quick access to what you need, there are more. But doing those things and bringing those to the forefront of our practice, our protocols, our algorithms, we saw a drastic improvement. When we were building a new building, we had a young engineer that was right next door, and she experienced symptoms of stroke. They brought her right into the emergency department because we were very, very close, and she was treated with TPA. She had a complete resolution of her symptoms, and I got to see her about a week after that, and she was so grateful. Her family was so excited about it. We brought her back in, and she spoke to the EMS community, and they were really happy to see this is what we do. We bring people in and they get treated, and there's a good result. This year, 2015-2016, we'll be receiving for the third time our Gold Plus Award, our Target Elite, for achieving those goals of getting emergency medicine to people within 60 minutes, and now we're going to 45 minutes. So getting those awards that say, you know, I remember when we were bronze and we wanted to get better, right? So it was like, will we ever get silver? And now we've been Gold Plus for 4 different years. And it's hard to believe, but it's exciting, and it's something you can maintain by continuing to use the tools that we have. It's pretty exciting to have the American Heart Association come to your building and present you with an award, and you invite your administrators and you say, this is what we work on, and we're all excited about it. When I was asked by an administrator, is keeping Get With the Guidelines, is that important? And I said yes, because it's like the Betty Crocker seal. People know what this is. Everybody everywhere in the stroke world knows that if you're doing great with these measures, you're providing great care. So that's what I'd say to someone who asked me why to do it. And secondly, if you don't know what you're shooting at, how do you hit the target? And when you have Get with the Guidelines and Target Stroke, you know what your target is.